And now joining us live on the news tonight is the Zonal Medical Director, Warri Central Hospital, Dr. Paul Okubor. And he'll be speaking on the second wave of the Covid-19 amid non-compliance with the protocols by residents in Warri and environs. Thank you very much for joining us tonight. Good evening.
Good evening.
Now, we're talking about the second wave of COVID-19 hitting the country on a daily basis, and residents in Warri and environs, including market women, still see this or perceive this as a scam. What do you make of this?
Well, I think it's quite sad and a sad commentary on our attitude and perception as a people. That despite the evidence of the fact that COVID-19 exists and the damage in terms of illness and deaths that it is causing amongst the populace, it's quite sad to note that a lot of people still don't believe, and a lot of people still don't abide by the basic protocols established by government and healthcare officials to ensure that our people don't get infected with the COVID-19 virus. And so marketplaces, churches, and everywhere where people congregate, it's quite sad to note that people don't wear their masks, people don't wash their hands, people don't do the basic things that we're advised to do as ways of preventing the infection. And I think it's quite sad because government has done a lot to ensure that people are aware of the disease. Government has done a lot to ensure that people know the basic things to do to ensure that they don't get infected by the virus. But unfortunately, people are not, by their conduct, by the way they are carrying out their activities.
In your jurisdiction now, what do you feel is the reason for this unbelief, this popular unbelief by people and market women? What makes them not believe that there's COVID-19?
Well, it's quite difficult to say. A lot of people have said that they don't believe because a lot of awareness campaign has not been done and all that, but I don't think that is correct because for me, I think a lot has been done. People are aware that COVID-19 exists, but there's this doubt for reasons that I really don't understand, that people still don't believe that it exists, despite the fact that today we can't be talking about, oh, the first wave, many people did not die, but in this second wave, a lot of people are dying. Prominent people's names have been mentioned that have died all over the place, and even in our environment, people have lost family members, people have lost friends. And so it's quite difficult. It boils down to our behavior as a people, that a lot of times, sometimes that people don't have trust in government. And so anything that government says, it's quite easy for the people to say, oh, we don't believe, we don't trust them. But the fact is that there is enough reason for us to believe that COVID-19 exists and it indeed exists. And so we need to come out from this negative perception of the whole picture. And then,
all right, now lack of trust, and rather of trust on the part of the government. Now, the Delta State Governor Ifeanyi Okowa ordered the reopening of isolation centers across the state, but people still think the state is not prepared to handle it should positive cases go out of hand. Is the Warri Central Hospital Isolation Center ready to admit patients?
Yes, I can tell you that, yes, very boldly and confidently. And then talking about Delta State, I can tell you that our governor has done a lot. In fact, the first wave, our governor was amongst the very first to establish isolation centers and do all that was required to ensure that the people in Delta State, that we don't get overwhelmed. Okay, isolation centers were established, at least 4 isolation centers in Delta State, treatment centers. And the 4 treatment centers are still working. People are being admitted, people who are sick are being admitted. And so it's not a matter of whether we're ready. At any point in time, any person who requires admission on the basis of being infected with COVID-19, with severe disease or moderate disease, requiring admission, of course.
All right.
Treatment centers
Hospitals are ready, state government is ready. You would recall that last year there were challenges of insufficient PPEs, that's the personal protective equipment, which led to resident doctors downing tools. Has the state government made adequate provisions for this and other essential like testing kits?
Yes, like I said before during the first wave, our governor, His Excellency, Senator Dr. Ifeanyi Okowa, was amongst the first governors to establish isolation centers, recruit required staff, and provide PPEs. And when it was said that resident doctors went on strike, it wasn't doctors in Delta State. All isolation centers worked throughout, our hospitals worked throughout, and we did not go on strike throughout the period of the first wave, and even now. We have our PPEs, we're working, and we're ready to cater for the needs of patients who are infected with COVID-19.
Okay, thank you so much for your input on the news. That was the Zonal Medical Director, Warri Central Hospital, Dr. Paul Okubor, talking to us on the second wave of COVID-19 and preparedness from the state government to handle these cases.